Hey, deserving listeners, we have a very special guest with us today, Mike Weber, who is a very interesting individual. I received a book that was written by Mike Weber and Andrea Dunlap called The Mother Next Door. It's about Munchausen by Proxy. And I get requests of these sorts with a lot of books that are being released. But I have to say that this book, I genuinely want to read every single word because I started reading it and I was very much hooked. And I can't wait to finish it and give it to my wife and say, you got to read this book. Again, the book's called The Mother Next Door, Andrea Dunlap and Mike Weber. So welcome to the podcast, Mike Weber.
Thank you for having me.
So I've only read some of the book, so I don't know the whole thing, but I do know enough to know a bit about your story, which is interesting. In that you are not an author by trade, you're a law enforcement officer. Is that correct?
That's correct. Recently retired.
And the way you got into writing this book with Andrea Dunlap, who is an author, I find to be interesting. So let's start from the beginning. What attracted you to working in law enforcement?
Oh, gosh. It's an interesting story. I was 19 and immature, and I was, working at Larry's Shoes and Boots, being a stocker, and an older guy who worked there who was 23 and really cool. He owned a Corvette, you see. He came in and he's like, yeah, I'm going to the police academy. I knew nothing about it at the time, except they gave me, tickets whenever I did what I did when I was younger, driving. And so I'm like, why do you want to be a cop? They just give me tickets. He's like, well, if you're a cop, other cops don't give you tickets. I was like, how much to pay? He's like, a lot more than here. I'm like, I want to be a cop. It's literally my sole reason. Now, obviously, once I got into it, it became much more important to me, the aspects of helping people and, basically, being a police officer is like being a street psychologist, right? You have to deal with people all the time and you have to de-escalate and you have to handle situations that can go really bad. So all of that intrigued me. Thankfully, I started a small department and then worked my way up to bigger departments as I went.
And this is in Texas?
Yes, in Tarrant County, Texas, which is Fort Worth is the anchor city here.
And somehow you ended up working specifically in cases involving child abuse. Tell me about how you got into that.
Again, I worked and none of this is planned. I worked narcotics. I was undercover narcotics investigator for 4 years. My sergeant's desk was 5 feet away. My lieutenant's desk was 10. You have to rotate out after 4 years in narcotics. So I did my 4 years. I rotated out, went back to patrol, and I was looking for something in investigations to do.
Wait, do they rotate you out because they don't want you to be corrupt?
And that's the thought of that. Yes, that is the way that agency thought at the time. But the way, undercover narcotics is not what everyone thinks it is. No one goes deep undercover. It's very, very different than what is portrayed on TV. So I was, they advertised a position for a child abuse detective, a child advocacy center. I had no idea what it was. I talked to someone who worked there, who was back on patrol, and she told me, well, yeah, that's, you're away from the police department. It's a separate building. I'm like, well, where's my sergeant at? Well, they're at the police department. Where's my lieutenant? They're at the police. So wait. You're telling me I can work separately, independently, and just do my job without having two people looking over my shoulder? She's like, yeah, sign me up. That was literally my motivation. Now, once I got in there, I realized these are the hardest cases in police work to investigate, oftentimes harder than murders because child sexual abuse, it's usually a delayed outcry. You don't have physical evidence. A lot of it depends on your investigation. That goes for abusive head trauma. You usually don't have witnesses that are old enough. If they're under 3, they're not going to be old enough where they can articulate what happened to them. It all comes down to the investigation. I found that very challenging.
What was your first case that involved Munchausen by proxy?
My very first case was a kiddo that actually came here from Ohio. His mom brought him here from Ohio, and he came into Cook's Children's. He had what I've come to realize is some common surgeries in this. He had a central line. He had a feeding tube. Mom had him on TPN, total parental nutrition through the veins. And the local police agency, at the time I was working for a local DA's office as an investigator, and the police agency wanted nothing to do with the case. It did have jurisdictional issues. So I was asked by chief prosecutor at the time, Alana Minton, if I would investigate the case. So I investigated it, knew nothing about this. There was no template. Thanks to Michael Trent, who was then a prosecutor down in Houston, who tried a couple of these cases. I talked to him. I talked to Dr. Mark Feldman, who's an expert on this abuse and has been kind of a mentor for me. They kind of gave me a pathway, along with Jamie Kaufman, my child abuse pediatrician. The most important thing she told me was these offenders know what they're doing when they're doing it, and they know it's wrong when they're doing it, and that this is abuse like any other form of abuse. So I took that and investigated it terribly because there was no other, I had learned nothing. It was my first investigation. All of the surgeries, which can be the actual criminal offense element in these crimes, happened out of state. So I didn't have an offense. We referred it to that other state. They did nothing with it. Thankfully, the child was protected and removed from mom and made a complete recovery, never needed a feeding tube, didn't need a central line. She had brought him into the hospital in a wheelchair, saying he couldn't walk. As soon as she was downstairs getting a drink, he was running up and down the hospital aisles. And once separated, he was a normal, healthy child.
How was the child identified as a potential victim of Munchausen's by proxy?
I think when he was able to run up and down the hospital hallways when mom went to get a Coke, and they just let him go and let him run up and down the hospital hallways.
But how was law enforcement contacted? Because that's always the fulcrum for me, is that, and research shows this, that when it comes to Munchausen by proxy, it's really hard for physicians, who are often the individuals that would notice the signs, for them to even notice it, let alone to report it, because they don't want to bother the parents. And even if they do speak up, other physicians will defend the parent who is abusing the child. Also, the parent can just move the child to a different facility, hire a different set of medical providers. So it's really hard for these cases to become known. Most don't, right? So how did this become known to law enforcement?
Well, thankfully, in this particular case, and I preach to pediatricians whenever I teach, if you suspect this abuse, you report this abuse, period. You're a mandated reporter. It is not your job to prove it. That is my job. That is CPS's job. That is police's job. Currently, CPS and police are terrible at it. And we can get into that later. But it is your responsibility to report this abuse. And thankfully, he did on this case. And that's what got the case kind of started and rolling. And like I said, I didn't do a great job on investigating it. I didn't really know what to do at that point in time. Now, there's a lot of things I would have done differently.
Like what?
Oh, I would have gone to the hospital and interviewed mom right away because the child was inpatient. I would have gone immediately because I could have lost evidence, right? I would have asked her, hey, even if I didn't have probable cause, I could have asked her, hey, can I search your purse? Can I have your permission to search your purse? She may have had syringes in her purse. There are numerous things law enforcement can do if we choose to do it. The problem is a lot of law enforcement continue to be uneducated on this. A lot of CPS investigators continue to be uneducated on this. CPS in my state has no policies on this abuse, and they provide no mandated training on this abuse. They don't even have a box to check when this abuse is reported. A lot of times they'll check medical neglect, and you've got a 25-year-old caseworker fresh out of college who doesn't know what this is, and they go out and they see a mom taking her child to the doctor all the time. That's not medical neglect to them. They clear the case, and police never even get involved.
Right. Yeah. The medical neglect term is usually used for child abuse cases in which you have a child that is in need of medical attention, like a regular dentist checkup because they have a cavity, and the caregiver, the parent, is neglecting to take the child to a physician. So you're not actively striking a child in a physical abuse situation, but you are abusing them through medical neglect. Whereas Munchausen by proxy, you can see how that doesn't really fit in that category, because it's the opposite. So it should have its own box, is what you're saying.
Right. Yeah, exactly. And, I've tried with our state CPS. I've sent them Arizona's policies on it to the office in our state capital, and I've sent it to them 4 times. And large government agencies are reactive, and they haven't done anything yet.
Yeah. So are you saying that if you had investigated it the way you know now and had, for example, immediately gone to the hospital, are you saying that because of the way you investigated that first case, she was alerted, the mother, about the investigation and had time to kind of clean things up so that it was harder to investigate? Is that what you're saying?
Well, right. Who knows what evidence I missed at the hospital. If I would have gone there, maybe she had evidence in her purse. Maybe she would have told me no. You don't know what you miss if you don't follow the steps, which is what I now teach, right? Also, that case was kind of before social media. I preach now to CPS, call law enforcement beforehand. I automatically preserve all social media before CPS ever contacts them, because these offenders, there's actually a website that tells these offenders to delete all of their posts about the child's health if they are contacted by CPS. I've actually had an offender Google how to delete Facebook. Once I got a search warrant for her devices, I found that the day she was interviewed by CPS, she Googled how to delete Facebook, and her Facebook account provided a lot of evidence.
I see. So you are saying now in your training that as soon as there is a possible case of Munchausen by proxy, it's important to immediately gather information from social media, from Facebook and Instagram, instead of giving them the opportunity to delete all that stuff.
Right. And as a law enforcement officer, I can't immediately get that information. What I can do is immediately preserve it. So I can send a letter to the company saying, please hold on to this account. And, with Facebook and Instagram, anything Meta, if they delete it, it's gone. They don't keep it. So that's why that's important to have that step done. And, that can open up doors to developing probable cause to get into their devices. And with social media, if the allegation is mom is, let's say it's a falsification case, right? She's lying about medical history of the child in order to get a feeding tube inserted into the child, let's say, which is the most common surgery that we see. If she is posting on Facebook about the health of that child, about surrounding these allegations, or really about the health of the child, period, that is probable cause. Anything she says is evidentiary in nature. And what we find through those posts, when you start looking at them and you compare them to medical records, what's happening in the hospital and what she's posting about is often wildly different.
Huh. Yeah, interesting. Yeah, I don't specialize in this. I don't think work with a case. I mean, I've been a therapist for 30 years. Sometimes I forget things, but I don't remember having worked with a case like this. But from the case studies that I've looked at, I remember reading cases from years ago prior to the current landscape of social media. So I'm hearing what you're saying and sort of extrapolating from it that, yeah, of course, if you have Munchausen by proxy, you're a parent who is getting emotional gratification and is almost obsessively and compulsively, devising situations throughout the day to make it seem like your child is not only sick, terribly sick, but you are the best caregiver ever. And in order to do that prior to social media, it was hard because you had to signal in public or to friends and family, try to get on the news somehow. But in today's social media landscape, you can post all day long. You could create your own YouTube channel. You could have your own brand that is about how wonderful of a parent you are. And you are going to get second by second gratification from people online praising you, especially if you're good at lying and good at social media, which you would imagine they would be oriented towards learning those skills. Then it almost seems like breeding ground. Social media seems like breeding ground for Munchausen by proxy. That's really interesting. Yeah, I would imagine that would be a huge part of your job is locking that down.
Yeah, sure. And if you look back, if you were going to commit this abuse in 1992, right, what would you have to do as an offender with no medical knowledge? you would have to go to the library. You would have to put in work, right? This would not be an easy process to find out what to present to doctors in order to get a false diagnosis, right? Today, it's a 5-minute Google search. And then as far as the attention-seeking aspect in this abuse, you have social media at your fingertips. So you have both the means to commit this abuse and the fulfillment aspect of it immediately available to you all the time.
Wow.
And so, yeah, I think we have seen an explosion in cases. Interestingly enough, a study done, 2022 study out of Seattle Children's, interestingly enough, looked at 145 cases of reports of this abuse in their hospital over 5 years. And they were able to confirm 65 cases of Munchausen by proxy. 32 others, they had a panel and everyone had to agree. And there were 32 others that could be, could not be. And, I asked one of the authors of that study, well, how many police investigations were there into these cases? She's like, I think maybe one. Isn't that interesting? And, just the numbers that I've seen since 2019 until I retired in January of 2025, I filed cases on 12 or 13 offenders in one Texas county.
Yeah, to me, in situations where there's massive injustice and also just complete ignoring of the situation, the common factor is that the people that are suffering don't have any power. You have a child who has no power and has been abused and truly gaslit into believing that they have these things. And they're the only one that really materially benefits when people push back or even begin to investigate this. The physicians don't necessarily benefit by questioning this because, in a cynical way, you'd say, well, they lose money because they're being paid. But in a less cynical way, it would create so much headache and paperwork and extra work and meetings and discussions and interviews and advocating and fighting with the parent and risking a lawsuit if you're wrong or if you're demonstrated to be wrong.
Even if you're not wrong, there's every possibility you're going to get sued in this abuse. And you look at the Maya Kowalski case in Florida, that doctor got sued for simply reporting the abuse. And then you turn around and you look at the Kelly Turner case in Colorado, and that hospital got sued because they didn't report the abuse. So doctors are getting sued either way. So what I tried to tell doctors is, I would rather, if it were me, I would rather be sued for doing the right thing than sued for not doing the right thing.
Well, and also, anyone can be sued for anything, but to be successfully sued. So if you had protocols and a standard of practice that will hold water in a court of law, it's like, well, yeah, even if it was the wrong choice, ultimately, given the scenario, it was the standard of care and maybe even the legal standard that under these circumstances, we make a report and we hand it off to law enforcement. So they're the ones that are now in charge of investigating. And I was just telling them what I knew. So until that happens, then, yeah, you're going to have these conundrums for physicians where they're kind of hung out to dry, right?
Right. And interesting is the last two peer-reviewed article in the Juvenile and Family Court Journal on this abuse were in 1990. Family court judges are pretty lost on this. You're lucky if they get it right about 50% of the time. And there's several cases in Seattle. The Sophie Hartman case is one that's been pretty public, where she was allegedly accused. And she turned around and sued everybody because that's what these offenders do. It's more, number one, it's yet another way to get attention, and it's also a way to get money once you're done. Not only do they do that, in my state, they also run to the state capitol, and then they tell your politicians how they've been falsely accused and how family court has cleared them. Family court doesn't clear anyone. That's not their function. But that's what they sell to politicians. And they sell that to the media. And what's the better story? A mother simply abusing her kids, or a mother who's wronged by the terrible medical system? These are some of the complications in this, in investigating these type of things further down the line. They can affect me, but all I deal with are the facts of the case. I look at the facts. If I feel I have probable cause, I take a warrant to a judge. If the judge signs the warrant, I make the arrest.
So to get to the book that you co-wrote with Andrea Dunlap called The Mother Next Door, in the beginning of the book, Andrea describes how she was abused by her older sister and had...
No, Andrea was not abused by her older sister. Andrea's older sister was abusing the older, per Andrea, her older sister, her family felt was abusing her children. And it was reported to CPS twice.
Oh, the older sister was abusing Andrea's children.
No, her own children. The older sister was, yes.
Her older sister was abusing her own children. I see.
And it was reported twice by medical professionals and in a span over about eight years apart. And CPS tried to do the right thing the second time, and family court judge gave the child back to mom.
And this is a Munchausen by proxy case.
Correct.
Yeah. Okay. Interesting. Well, so I hadn't gotten to that point of the book yet. Thanks for spoiling it. Just joking.
Sorry.
No.
Well, I didn't want Andrea to think people thinking she's being abused.
I would be putting out silliness. I was trying to figure out from context what she was talking about. It was a very compelling narrative. I was really hooked by it. But okay, so she in the book describes how she started to feel ready to write about it in a fictional sense. She was fictionalizing the scenario. And then she is on a book tour, and that's when she met you. Is that right?
No, she had come to a training in San Diego. She actually, because of the book, she met Dr. Mark Feldman and talked to him about this abuse. And then she came to a training that I was giving in San Diego at the time. Interesting side note is the sheriff, I left the DA's office and went to the sheriff's office in 2018 in Tarrant County. And one of my first 6 victims of this abuse, and one of the stories in the book, the sheriff ended up adopting. It was a distant family member of him. So Andrea met me and the sheriff at that conference. And I made people were always telling me, you should write a book. And I'm like, yeah, no one cares what I have to say. And so, I was talking to her. She told me she was an author. I'm like, yeah, people tell me all the time I should write a book. But she's like, no, you should. And she's like, Mike, look, here's the thing. People say that to me all the time. And I normally think, no, you really shouldn't. She's like, I'm serious, you should. And of course, I think we both had the thought at the time that she should probably co-author it with me. She was hesitant to take on additional projects. And I didn't want to beg her to write a book with me. Obviously, she had the connections in that industry. She had written 4 previous books. She had been in the publishing industry before becoming an author for 8 years. And so, I tried to write it. I write like a cop, right? It was on this date, I went here, I did that on this. And she finally was like, hey, why didn't I co-write this with you? I'm like, that's a great idea. And so that's what we did. And I think it makes a lot of sense once you get into the book. Andrea is nothing if not a thorough researcher and she also brings to the book the element of the family, which is something that I don't have that experience to bring to the book, and she does.
I haven't read her other works, but she's a very thorough but compelling writer. It reads like, I don't know. I remember the first time I read the first Harry Potter book, and I thought they should make this into a movie. It's so visual. Her book is very visual. As I'm reading, I'm like, oh, I can picture it. She describes you in the book, and I had a picture in my mind about seeing you over video conference. It fits with it somewhat. So anyway, it's a really great combo, and I imagine for her and maybe even for you, it might be a little bit emotionally healing on some level to get this out there. Was that true? Sure.
Yeah. And, we talk about 3 cases in the book, and one of the cases I'd never talked publicly about before because that alleged offender, the DA dropped the charges. And, oh, by the way, she's now an elected politician.
Wow.
I'll go figure, right? So,
Do you want to talk about that case? Tell us about that.
We can talk about any of the cases. That was a Murray Welch case. She had got a brain shunt placed in her son in Minnesota after she was told her son did not need a brain shunt here. She also, according to family members, lied about having cancer herself. Told me on the phone call she had cancer, but couldn't produce what doctor had diagnosed her, which we see this quite often in these cases. They'll often also lie about their own health conditions. We really go in that case to the failure of the system in addressing this abuse. The family court system in Tarrant County basically wanted to cover their eyes and shut their eyes and cover their ears and say, nah. They did not want to hear anything. And so child was given back to her, even though he had been in dad's custody and perfectly healthy for quite a while. He was kept out of mom's custody for about 6 months.
So how is she a politician now?
Well, she's elected to city council, and it's a small Texas city in the county just south of Tarrant County.
Wow. According
to several people, she had told them she was a nurse, and she wasn't. We're all responsible for who we vote for. So if that community wants her to be on their city council, okay. Now that the book's out and they know the whole story, I don't know if that will continue.
Yeah. Do you know the fate of the child?
Dad told me that the child had the brain shunt removed, and then she got it replaced again. The child was five or six when he got the brain shunt placed, and then something happened to get it removed. I'm not sure what. But then she took him back to the doctor several years ago. He's now an adult, but he took her back to the doctor several years ago and got it put back in, even though Dad went to the doctor and kind of told him, hey. But, with a brain shunt, I was told at the time of the investigation, you can also become shunt dependent if you have a shunt in that you don't need. So I don't know. Whether that was needed, we don't know.
Wow. We've already discussed a little bit about why the authorities, the courts, others would look the other way. But why in this case would the court look the other way?
It depends on which court you're talking about. Family court, they don't know what it is. It's hard. It requires a lot of time. The offenders in this case, they're really good at manipulating systems. They're good at manipulating the medical system to get what they want, done to the child. They make the doctors the weapon. They're good at manipulating the court system to get access to the child back in their care, and the family court system. And in family court, like we write in the book, not to spoil it for too much on this, but just a little tidbit, the family court judge was seen by a witness. He said, I know what Munchausen by proxy is. And the witness watched as he Googled Munchausen by proxy. And, as a judge, you should be willing to admit when you don't know what you don't know. And you should be able to listen to witnesses who do know what you don't know. But that didn't appear to be the case with that family court judge. I also had the ad litem for the child, who's now an elected judge in Tarrant County, Judge Kenneth Newell, tell me in a meeting in my office that he did not care that mom had lied about being a nurse, that he found that immaterial. I'm like, she used that to influence doctors in another state. He did not care. He did not care that she lied about her own cancer. And
the ad litem, just so people know, the ad litem is an advocate for the child, not
supposed to be. Yes, unfortunately.
Often the ad litem's job is to fight for the child against the parents.
Depending on the evidence of the case, correct.
Well, often, right? Or the state. I mean, the ad litem, they get into that job, that position, because they deeply care, often in a very personal way, about child abuse and about the fact that children don't have advocacy. So to have what sounds to be an ad litem that was biased and not fighting tooth and nail for the child is upsetting.
And these offenders are extremely manipulative. Mom had money. Her family had money, which seems to be a big player in family court. Dad Dad didn't hire the best family attorney, and CPS decided not to be involved in the case. They decided, just since we had a protective dad, just to let Dad get his own attorney, get an order, an emergency order, and then just let Dad's attorney deal with it, which was a huge mistake in that case. And when CPS tried to get back involved after things started going sideways, the family court judge walked in, saw them unloading their stuff, and said, "You're not involved in this case. You need to leave." What I've learned about family court is they don't correct mistakes. And that's a big issue in family court. I mean, there's a lot of issues in family court. And just so your listeners know, I have never been married and have no kids, so my entire dealing with family court is on a professional level.
You're not biased.
Yeah, I am not. But my only dealings are from experiences I've had at testifying as a witness.
Yeah. So I have professional experiences with family court as well, not in this specifically, but in very similar cases. And yeah, I mean, it runs the gamut. You have some judges that know what they're doing and a lot of judges that don't. And there's even judges, I've been yelled at by judges, even though I wasn't on either side of the case, for ridiculous things. And I didn't care, so I didn't fight back. But at the time, I completely lost faith in judges in general, not in all judges, but in the institution that I had been sold as being filled by individuals. The position, when you're given that position of judge in any circumstance, in any sort of court, my assumption was that you were the most intelligent, wisest person around, and that is just not the case. Some judges seemingly are just grabbed off the street and put into the robe and sat in the chair, and they have no idea what they're doing with anything, let alone the law. And so anyway, I having said that, there were some judges that were tip top and wise and intelligent.
And as I say in the book, we all talk about systems. Well, systems are people, and it comes down to the individual person making that decision. And I think we all need to keep in mind, at least in my state, district court judges are elected. So you may not be getting the smartest person. You may be getting the best politician.
Wow. So when it comes to Munchausen by proxy, I've learned this before, but it's becoming very clear to me now, and I'm sure this is something that you and other experts know quite well, is that the very system that is designed to protect children and to put these people potentially behind bars, or at the very least get them separated from the children, is the very system that gives half of the gratification to these perpetrators, because they are dragged through the system, as they would put it, and there's more social media posts and more sympathy. And especially when they win in courts, then it's even 90% of the attention that they might be getting, because that's the whole reason why they do this, is because they want to get attention. 90% of the attention they could be getting is because of failure in the court, right? So that is upsetting.
Correct. And that's just how they are extremely adept at using the system to get what they want, and you get more attention that way. It's common among these perpetrators, and you have a void of education in family court with family court attorneys, family court judges, CPS prosecutors, or CPS attorneys, I should say, who handle the child abuse cases. And human nature takes over. You see a ton of work. You don't really know how to do it, so you find an excuse to get rid of it. And that's what we see in these cases over and over and over again. And there's several examples in Seattle. And another problem with family court is just the way the system is set up. Family court decisions are always going to happen before a criminal court, right? It's going to take about 2 years to go to trial in a criminal court. So if there's a criminal charge against the person committing this abuse, family court's going to make a determination on custody before that. If they give that child back to the offender, prosecutors are going to be very, very, very hesitant to go forward with a criminal trial. because then the defense is, well, family court gave the kid back and they only need a 51% burden. Well, family court in this abuse, quite frankly, is lost, and they need further education.
Well, another factor that I ran into a lot is that family court is, I think, for a lot of good reasons, hesitant to separate children from their parents.
Yeah. And it's mandated to family court that family reunification. I mean, that's the goal of CPS in almost every state.
Yeah, that's the work that I did. Was CPS would call me as a therapist. So I would go into the home and reunify the family. But I hadn't worked with a Munchausen by proxy case, but it was a sticky situation. But a lot of times I could help. But if I ran into a case like this, one of the problems that the perpetrators can exploit is that children, particularly very young children, aren't very verbal. And if they are verbal, they don't really want to talk to therapists, or they don't want to talk to CPS investigators or police officers, right? So you have the necessity as a clinician or an investigator to ask the caregiver for information. 99% of everything you might know about a child is through the caregiver. And most of the time that is wise, in that the caregiver is on the child's side and is an observer 24/7. And so it's a good vector of information. But in this case, it's the person you should be not talking to. And these perpetrators, Munchausen by proxy, are very effective at separating the child from anyone that would have more information, right?
Absolutely.
So these perpetrators exploit that, right? The cases that I have read about are along those lines, where you'll have a doctor that will, years into it, will think, I am looking back now and realizing that all of my assessment data was based on report from the mother. And at no point did I ever actually conduct my own independent assessment of that child. The mother told me that the daughter wasn't eating. The mother told me that the daughter was throwing up. The mother told me that the daughter was having seizures. I never saw evidence of that, but normally that is accurate. And I'm not in a position, or I'm not trained to suspect that a mother is going to invent all of these symptoms. That's just not how I'm oriented. So it took a long time. So, the perpetrators will exploit that.
And there's a great paper done by Dr. Mary Sanders and Dr. Brenda Bursch on offender treatment in these cases. And number one, it's evidence-based. So you have to review all medical documents. You have to, question them. But that offender treatment paper also says that if they cannot accept responsibility and feel some remorse for what they've done and some empathy for the victim, that you move to termination, right? And again, we have family reunification as the stated goal by CPS. So how's that going to work? You have you have the literature butting heads with the system, and it's been my experience the system wins every time when that comes up.
Well, one thing is there's not a lot of money. They don't have money to place enough children. Usually all the placements for children when they're separated from the parents are filled with the worst cases, the obvious worst cases, where you have, typically it's a single parent that is strung out on meth and is actively physically abusing and neglecting the child. It's very clear. Those children are given priority when it comes to, placements that are expensive, because the tax dollars just aren't being allocated. So you have CPS workers that are trying to prioritize. People don't get into CPS because they don't care about children. They care about kids. So if they had it their way, they would err on the side of safety, but they just don't have the dollars, at least in my jurisdiction.
Well, and one of the problems with placement in these cases is you cannot place with a family member that is unbelieving that this is occurring, right? That can be manipulated by mom, because all you're going to have is Munchausen by proxy, right? They're not going to follow any of the court orders as far as keeping mom away from the child. Mom's going to manipulate their way back in. And in the Sophie Hartman case, I believe they placed those kids with Sophie's parents or sister, and none of them believed that mom was doing this. So when that happens, you're you're going to have the abuse just continue in their care. And that's a point I try to drive home to family court judges when I can get them in a room for a training.
Yeah. But even if you're a foster parent and you're available and there is a bed available, I would imagine that if I were a foster parent in that situation being referred a case like this, I'd be like, yeah, no, I don't want to deal with this. You're telling me you're giving me a child who may or may not have some of the most difficult medical conditions requiring throughout the day care. One, I don't have the time for that because I've got 3 other kids under my care. 2, you're telling me I have to do all this extra work, not only to, because even if the medical treatments aren't necessary, you have a brain shunt that is slowly being transitioned away from the child. I'm going to have to monitor that and create sterile environments or whatever. But also, I'm now having to assess whether or not, because you're going to be asking me questions like, how is the child doing? And do you see seizures and this kind of thing? And what if I get something wrong? The child dies. The child has a legitimate issue. And I go to a different facility. I would just imagine it would be difficult to find people that even if you paid them to take a child like that.
Well, and what we've done is if we can get a CPS removal, we try to get a hospitalist to admit them into the hospital and wean, especially if there's tons of medication, because we got to wean them off the meds, make sure that's done safely. And multiple people observe this child and hopefully get a lot of that stuff. Well, and what we see on these cases is once you get the offender away from the child is dramatically different, right? The child immediately starts to recover and doesn't need it. The child can eat. The child doesn't need the feeding tube. In a lot of cases, some cases you may have to teach the child to eat if it's been a long time that they've been on the feeding tube. And then we'll put them in foster care after that hospitalization, so they don't have to deal with all of that as they go forward.
Why is feeding tube so popular?
Well, it's like Dr. Kaufman told me when I first started this, it's easy. You starve your kid at home. You tell the doctor that your kid's refluxing, has constant diarrhea, isn't absorbing the food properly. The doctor sees your child for 15 or 20 minutes, right? Meanwhile, as the parent, you're pushing for the feeding tube. You want the most invasive thing done, and you're eventually going to find someone to do it. And the thing people ask all the time, well, why would a doctor ever do a surgery that is unneeded? These offenders, and the reason we see so many feeding tubes is they pick things that are extremely medically hard to test for. Gastro issues are one of the hardest things to have a definitive medical test on. So we see a lot of gastro complaints in this abuse. I used to think they all had a playbook that they were sharing amongst each other. And I realized, no, they're just taking the easy path. They research it online. They figure out what's easy to test for, what's not. And they pick the things that are very hard to medically test for, then rely on the history from the parent in order to diagnose.
And you can administer medications without protest from the child through the feeding tube.
Right. Once you have, like Dr. Kaufman says, once you have access, once you get a feeding tube put in, now you have access to put anything in or take anything out of that child that you want. If you get a central line placed, now you have access to the child's blood. The sheriff's daughter's case, that offender was poisoning her blood with feces. The Hope Ybarra case, another case in the book. She was putting pathogens that she stole from work into her child's breathing treatment to present symptoms of cystic fibrosis that the child did not have. And I tell people all the time, the only thing that limits these offenders is their imagination in the way that they commit this abuse.
In your experience, why do they do this?
I tell people all the time, every single case is fact specific, right? I will say that in every case that I've had, except for maybe one, there's been an attention-seeking element, whether it be social media, whether it be love from a family member. There's been an attention-seeking element in every single case that I have worked.
And it's a very specific attention. It's, you are a saint. You are a saint. You're a hero mom. You're the best mom. You're better than me as a mom. You're the best mom ever. If I were in your shoes, I would give up or I wouldn't persevere. You are doing clearly heroes mothering. And it's because it's, I don't know, something like 95% of the time it's a mother, right?
Yeah.
So
not 95.6, the mother, 97.6% female. From a 2017 literary study, looked at 796 cases.
okay. Well, I was just shooting in the dark, but I was pretty close, I guess.
You're dead on.
So it's that kind of attention. So, but why do they need that kind of attention? I mean, there's other ways to have self-esteem.
Yeah. It's, it just depends on the offender. When I've gotten admissions, and I have gotten admissions from several offenders, I don't get confessions. I don't call them confessions because they never admit to everything that they've done. By the way, that's every child sexual abuser. That's every abusive head trauma suspect. That it is a standard child abuse interview. They present no different in an interview situation, a police interview situation, than any other child abuse offender. The most truthful thing that I've ever gotten from any of them, as I got from 2 or 3 of them, is that they either call themselves a pathological or habitual liar. And that's really the most truthful thing. They admitted some parts of their behavior. Interesting, like with Hope Ybarra, who's in the book, she minimized her behavior, and she only admitted to the things that she thought I had proof of. As a police officer, we're allowed to lie to people in an interview room, tell them we have things we don't have necessarily in order to elicit the truth. That's a very tricky proposition. And when I teach, I tell them, you better make darn sure that a jury is going to be okay with you doing that, right? And for her, I just lied and told her we had the results of the sweat test for cystic fibrosis. And I lied and told her that we had the blood test, which I was wrong about. It was actually wasn't a blood test, but that still had the pathogens from her lab in the child's blood. And we were DNA typing those pathogens to find out if they came from the lab or not.
So in interrogation, you were putting the screws to her, trying to get her to confess or to reveal something.
Right. Those are the only 2 things she admitted to. She admitted to falsifying the CF test, and she wouldn't admit to putting the pathogens in her daughter's breathing treatment. Although interestingly enough, she did later in news interviews after she pled guilty. But she admitted to putting it in her child's sputum sample. So
by pathological liar, what do you think they mean by that? Like it's a compulsion, like they can't help it? What do they mean?
Yeah, Andrea compares it to addiction. I don't, because addiction is self-centered. I compare it to a compulsion. I oftentimes compare this to what we see with sex offenders, right? They have a compulsion to commit the abuse. They don't care about the consequences. There's a lot of commonalities. The manipulation of adults around the offenders. With sex offenders, it's to get access to the child for sex. With these offenders, manipulation of the medical community to commit the abuse, manipulation of the court community to get access back to the child. There's just numerous things that are very similar. The grooming of the child as the child gets older in this. They learn their sole method of getting love from this parent is to play the sick role. So what do you think a kid who's had this done her entire life until she's 12, 13, 14 years old is going to do? They're going to play the sick role. They also have no baseline for health. So that also plays into it. So there's a lot of commonalities that I see with pedophilia in this.
Interesting. Yeah, the way I conceive of Munchausen and Munchausen by proxy, factitious disorder, is that the individual, due to severe trauma of some sort growing up, has developed a compulsive, inner, deeply pervasive need to constantly gain attention and sympathy and love and praise in this very specific way. Because if you're generally narcissistic, there's a lot of ways that can manifest. But if you have this particular, usually I would imagine that these cases have some form of early gratification when they're young. Maybe they took care of a younger sibling, or they saw someone as the perfect mother, or when they became a teen, they got sick themselves and suddenly got attention for the first time. On one hand, they can't help it, but on the other hand, they know that they're doing it. And they create all of these justifications around it, and it becomes this runaway cycle that they just can't, and also at the same time don't want to stop. And I think that's maybe where you're coming down. It's like, I don't know if I want to call it an addiction, because that makes it seem like it's a disease that is imposed on the person. But it is akin to a personality disorder in my mind. As I've been reading the book and as I've been thinking about it, I have been actually taking notes in my various different docs that I keep, keeping track of these kinds of things. and I actually added Munchausen and Munchausen by proxy as a 15th personality disorder. Because, the DSM has 9 personality disorders, but there's personality disorders like sadistic personality and others that aren't included anymore. And I've been adding to this list of like other manifestations of this, in that it is a pervasive need based on trauma. It distorts and it becomes their entire orientation in a way. Because what people will think of Munchausen is that the individual just has a lot of health anxiety, or they're a hypochondriac or something. And that is not the case. They absolutely know that these things are not necessary. They 100% know.
Well, and they demonstrate that in a police interview by first lying about it, and then eventually telling you, you can get admissions, never the whole truth.
Right. Because if it's truly just health anxiety, which can happen, then you wouldn't have someone putting feces into the blood. Right.
and their story wouldn't change. They would honestly believe their child is actually sick, and they don't.
Right. And it wouldn't have the look of it. They would say like, I don't know, like I saw my kid, she looked really lethargic this one day and I just didn't know what to do. And, please doctor, do something. You need to do something. I know there's something wrong. She has cancer. And it can be a problem, that can result in abuse and harm to a child, but it'll have a completely different look. And it's a lot easier, I would imagine, to manage as a physician and in law enforcement.
Well, and it's funny you mentioned the cluster B personality disorders, because that is the most common psych comorbidity, usually narcissistic, borderline, or histrionic in this abuse.
Right. That's what I was thinking. It's very akin to histrionic, actually.
Yeah. Well, and with the more advanced offenders, the offenders who actually are inducing symptoms in their child, putting feces in the blood, suffocating their child, poisoning their child with massive doses of Benadryl. All of these are cases have actually worked. With those offenders, I really think the psych community should really start to consider that this is a certain form of female psychopathy. Right. I think we want to give mothers a break when dealing with their children. And, it's not just in these cases. As a DA investigator, I would see mothers get far less harsh sentences for abusing their children than I would see fathers, right? It's just the break of motherhood that we tend to give mothers in our society. And, I say all the time, in this abuse, we're fighting the societal concept of motherhood. That is the biggest struggle, is getting people over the hump to understand that, hey, guess what? Mothers can be just as terrible as anyone else in this world. And so I do think we should hold that out there. Obviously, I'm not a psychologist. I don't do that kind of thing, but I would be interested in seeing some studies to look at that aspect of it.
Yeah, absolutely. I didn't grow up. I love my mother. My mother is as a therapist and a family therapist, I can empirically evaluate my own parents as being above average for sure. So I'll just put that out there. And I will say that I, for whatever reason, didn't grow up with the cultural notion that parents, and particularly mothers, are beyond reproach. I bump up against that cultural aspect every once in a while. People say like, well, you're not supposed to talk bad about mothers. I'm like, why? What commandment is that in the Bible? It's ridiculous. Actually, I think there is a commandment about it in the Bible. But the point is that the reason why we revere mothers, generally speaking, is because mothers, generally speaking, are great and wonderful and loving and nurturing and there for us and sacrificial, self-sacrificial. But we all understand there's a bell curve, and there are some parents, regardless of gender, that are abusive or at the very least not great. And you say psychosis, and I agree in that with things like borderline, histrionic, narcissistic, it is akin to psychosis, akin to a delusion. That's why they called it borderline, is because it was borderline psychotic, in that the individual's perceptions are so distorted, not in the delusional schizophrenic way, but in a pervasive personality schema-based way. And they see the world differently. And it can result in belief systems and behaviors within them that are akin to psychosis. Like with someone with borderline, if they're in a relationship and you don't text them back right away, they can perceive that as essentially you having betrayed them and cheated on them, and they will come at you full guns blazing and attack you for being a horrible partner. And you're just like, I was busy at work. But to them, they perceive the situation as a massive betrayal and harm. And then that's what produced the anger. So for the individual with Munchausen by proxy, that's how it was starting to look to me, was that they perceive the world as being unfair, that it doesn't give them this attention. This is similar to histrionic. They start with that baseline that the world should be giving me this attention. And so the fact that they're not is wrong. And so I need to orient the world so that it gives me this attention because I deserve it. I'm entitled to it, right? Does this sound like the way that you see it?
Yeah. It's so hard to get into the head of these offenders just because they don't tell you the truth. Something you said earlier about childhood trauma. Well, maybe if it's verified, right? Because if it's not verified, then you're just trusting the word of a pathological liar, And I tell detectives when I teach, I detective CPS all the time. I mean, if she tells you the sky is blue, go outside and look up. That's what you have to do with these. You have to verify every little thing that they tell you, everything. But motivation is so case specific. I've had at least one case where I thought maybe the motive was benefits more than anything.
But there's easier ways to get money. You know what I mean?
Yeah,
like if you spend all that time in some other endeavor, like a part-time job or something.
Yeah. And if you wanted to get money this way, you could always just lie about your kid being sick online and not do anything to them.
Right.
Which is Munchausen by proxy, by internet is what Dr. Feldman calls it.
Or you could just make up a child and you don't even have a child and just. Right. So there are easier ways other than manufacturing illness in your child, carting your child around to various different appointments, trying to convince people, going through all the steps. This is a full-time job to conduct all of these experiments, because you imagine that these individuals, these perpetrators, don't get it right the first time. So they have to experiment with various different injections and other kinds of manipulations of the child. They have to experiment with various different doctors. I don't know about you, but it's annoying to go to the doctor. You got to drive there and you got to check in, you got to wait in the thing, you got to sit in the weird robe, and you got to, it's a whole thing. So, if it was just for money or just for mild attention or something, then there are easier ways to get it. And we know that people will engage in those other ways. This is very specific. So that's why it seems to me and there's no way to know this, and this is common in my world with all personality disorders. But the way that I see it is that the individual, everyone is born with needs, and there's also certain dials of disposition that you're sort of born with that are turned up or down. And that interfaces with the environment, and certain harms and solutions get encoded in one's neurology that become perpetual. And so for these individuals, it stands to reason, of course, it would be impossible to test because, as you said, you can't ask them about their history.
Right.
But even if you did, it would be hard to draw exact empirical, concrete causal connection between these things. But the way that I see it is that for these individuals, they must have been denied a set of core needs, and at some point it became known to them that the way to get a little bit of those needs met was through this sort of attention. And to them, it feels right. It feels morally okay. It's justified to engage in this sort of thing. It'd sort of be like, for me, if my wife, for example, were to be, I don't know, not paying attention to me for like a month or something. Like whenever I say hi at home, she just is like, yeah, get away. Well, eventually I would feel justified in saying, hey, you have to talk with me about this. This is hurt. I would maybe get a little intense and I would say, no, we have to. So in that situation, I feel justified. And for most people, they would say, yeah, that sounds like it makes sense. But for people with these sort of perceptual disorders, they will feel justified in taking that times 100 under circumstances that don't make sense to the outside world. So to these individuals, it's an exaggerated case, but that's the way I see it. But I am curious, Mike Weber, in that given your contact with these individuals, because I'm just theoretical, but you know these people. So is it possible that what I'm saying is consistent with your findings?
I think it's possible in the offenders that, there's a spectrum of this abuse, right? I think it's very possible in the light offenders on this abuse. By light, I mean, maybe they have a nasal gastric tube placed in the child and they get caught, or they're faking vomiting in the hospital to get medical tests and they get caught. They haven't gone to the surgical procedures yet. Maybe in those offenders, but again, I'm talking way outside.
Well, so let me, because and is another factor that pushes it to the higher cases, the more intense cases, is that they also lack empathy for other human beings.
Absolutely.
They're callous. They don't care.
Yeah, okay. Absolutely. They care more about their needs than they do anything else. But, it's funny because I often it makes a really good comparison to abusive head trauma, right? Because you care so much about your own needs that you're willing to shake a baby and slam its head onto a hard surface to cause fatal harm to that child to get your immediate need met. And that is what is more important to you. And again, that's my personal opinion on abusive head trauma cases. But and again, it's just the same thing with pedophilia, right? You don't care about those kinds. You want that compulsion and that need met, and you do that regardless of consequences to the child or your own consequences. Because with pedophilia, there's a very good chance you're going to get arrested if that child outcries. So to me, the compulsion is really the main key to this as far as offender behavior.
Compulsion may be matched up with lack of empathy. Right?
Lack of empathy, absolutely.
Which makes me wonder if there are people with the compulsion, maybe you guys are saying the lighter cases, they have Munchausen by proxy in a lighter case, but they also have empathy. And this is true about pedophilia as well. You can have attraction and a compulsion to have sex with children, but if you have empathy, that gives the possibility of the individual actually refraining from offending because they care, but they have this internal need. But you match it up with a lack of empathy, then you get a much more likelihood of offending.
Yeah, I serve on the APSAC committee on Munchausen by proxy with Dr. Catherine Ayub, and she actually does offender treatment. And she says she can count on, I think she said one hand, the amount of offenders that she considers have been rehabilitated and that were able to actually show empathy. And all of them have been on the lesser end of the spectrum as far as, the amount of abuse that they've committed to the child. And it's really important to your audience to know these offenders should require, which we don't do with CPS, is require lifelong monitoring if they're going to have access to children. Right. That's even though like some of the in Catherine Ayub's cases, if they've been reunited, they're still being monitored. And in my state, we don't do that. I would hazard a guess in Washington CPS, they probably don't do that either because no one has the money to continually monitor. And like in my jurisdiction, Dallas-Fort Worth, huge area, 7-8 million people. I don't have a psych specialist in this abuse in my area.
Yeah, it doesn't surprise me. Well, it's actually kind of rare it's hard to know because these individuals are so under the radar, but research shows that it's of the conditions in the DSM, it's kind of rare. Having said that, the cases that are out there, there's, probably tens of thousands of cases currently unidentified in the United States. So that's enough.
I would argue it's rarely reported. And when it is reported, it's rarely properly investigated by CPS and police. So we rarely find out about it.
I mean, that's what it sounds like. And that's, obviously a problem. So yeah, it is relatively rare. I would imagine, who knows, of all the cases of child abuse, even at a really high level, I would imagine that Munchausen by proxy is a small percentage, but it's still a percentage.
Right. The interesting thing about the Seattle study I referenced earlier, the 65 cases they were able to confirm over a 5-year period, that was 2/3 the amount of abusive head trauma that they had during the same time period. So is that rare? I mean, it's not sexual abuse, right? But it depends on what your definition of rare is.
Yeah. I mean, my point is that I understand if we're going to prioritize allocation of funds and attention, there should be some mindfulness regarding the prevalence. Having said that, whatever priority or attention that this should receive, given whatever sort of prevalence we would conservatively estimate, is clearly way below what it should be.
No, and people are working actively to keep it that way. We had a bill in the Texas Congress this session, which just ended. It was an education bill, an hour of education for pediatricians, law enforcement, CPS, mandated a year on this abuse, and they would not pass it. And they had parents' rights organizations come out against it.
Why would parents' rights organizations? Is this a slippery slope argument?
I don't know what their argument is, because currently when people aren't educated is when you get false allegations, right?
Yeah.
When people don't know what they're doing.
Don't they care about, I mean, to be like advocating against
don't get me started
reporting of child sex abuse. Like, why would you want to align yourself with that?
I say all the time, from an understanding perspective, this abuse is where child sexual abuse was in the 1960s and where human trafficking was in the 1990s. It's just, you have groups working against any education on this. And the thing about these offenders, they're extremely manipulative, right? So if family court doesn't do their job and there is no police investigation and they get the child back, now they can go down to your state legislature and tell them they've been falsely accused. And they have power they can have power with the state legislature, because if you get a politician, I mean, what's better than a poor mom that's been put upon by the system to get behind? It's a great story. And same for the media to report. It's a great story to report. And, they're not getting medical records. They're not looking at evidence, any of them, politicians, media, right?
But isn't it also a wonderful story to, identify a child that's being harmed? I mean, I don't understand. Yeah. Earlier,
I can tell you that that is not the case in my county from personal experience.
Jiminy Cricket.
And that's covered in the book, by the way.
One question before wrapping up. Earlier, I thought you said that there are websites that are out there guiding people with Munchausen by proxy.
There are. And I don't really want to get into what they are because I don't want to tip people off.
Wow. Knowingly, it's overtly like we are people with Munchausen.
Here is how you respond to this allegation. Number one, delete all of your social media messages. In my state, that is a crime. That is a 3rd-degree felony of tampering with or fabricating physical evidence. So they are encouraging parents to commit a felony in my state. And I'm not going to say the website. Like I said, I don't want.
Is it pretty obvious that the website knows that they're supporting people with Munchausen by proxy, or is the website supposedly supporting parents that are falsely accused?
Supposedly supporting parents that are falsely accused, right? But it's also some of the same doctors we see all the time as defense experts who will say that this child has a certain element after a 15-minute telehealth interview.
So known doctors that will say whatever the parents want. Say whatever the parents want them to say. Yeah, that's what's setting. Wow. Well,
some people will do anything for money.
Well, Mr. Weber, I want to thank you on behalf of society and children everywhere for doing a lot of work to help children in various different ways.
One thing I do want to say is my website is Mike Weber Consulting. If anyone wants training, law enforcement, I train to any discipline that touches this abuse, law enforcement, CPS, medical professionals, psych professionals. A lot of times this can be done just through a psych presentation, right? Through ADHD, autism, any number of psych presentations, and can be done to get just pretty horrific psych drugs, risperidol being one that I've seen several times. So I do offer education on this, and it's filled with peer review literature references. And so I wanted to put that out there for your listeners if anyone is interested.
Oh, I have one more question. What did you think of Mommy Dead and Dearest?
The HBO special I thought was really good. The Act, which was on Hulu, that was way sensationalized. But I thought the HBO special was really good. And I thought they got, they got her sentence about right.
This is the case of Gypsy Rose, who her boyfriend killed her mother, who had been through Munchausen by proxy, horrifically abusing Gypsy Rose. Gypsy Rose and her co-conspirator were convicted and served time. Gypsy Rose recently got out, though, after 5 years or something.
She did. I think she did 7 or 8 years of a 10-year sentence, and her boyfriend was sent to prison for life.
Okay. So you think that the sentencing was adequate?
For Gypsy, yes. I think it was a good sentence. Did she manipulate the boyfriend? She testified that she did. She manipulated him into committing the abuse. But, that's all she was taught her whole life was how to manipulate. She had no schooling. She had been abused from a very young age. Again, I'm going by Mommy Dead or Dearest, Dead and Dearest special, the HBO documentary. And it was, again, you see the pediatricians, doctors out there, if you're charting this abuse, you're charting abuse. If you're charting Munchausen by proxy, you're charting abuse. So if you chart Munchausen by proxy, you need to be reporting, and I encourage reporting to law enforcement and CPS and hope one of them understand what you're reporting.
Right. And follow up too. Don't just, yeah. So you think that Gypsy Rose was appropriately imprisoned and consequenced for murdering her mother. Why?
Well, number one, she is her mother's child. So she needed to learn that there are consequences for your actions. Number one, but she didn't need to have her life taken away from her because she was a terrible victim of abuse. She would have probably had a decent self-defense claim if she had killed her mother herself, but she didn't. She manipulated someone to do it. You can argue she deserved more. You can. A lot of people think she shouldn't have gone to prison at all. I do not believe that. I think prison was probably good for her, and she's actually said that, and that it helped her get some structure in her life that she didn't have. And helped her get a high school degree, And
helped her get away, at the very least, overall, she was away from her mom.
Right. Yeah. And as far as the sentence for the boyfriend, I don't know enough of his background to know, but I mean, she did manipulate him into committing that abuse. And he was, use a technical term here, he was not right to say.
Yeah. I mean, the documentary depicts him in a way that I would agree. It's sort of like the Menendez brothers in that if you believe the Menendez brothers and the abuse that they went through, I don't know, we might have sympathy and might say, well, geez, I understand that. However, you can't have premeditated murder like that. There are other options, and those options should be provided and given to these children. The system clearly failed, but we don't want to create a society in which vigilantism is approved of. Is that what you're saying?
Right. Well, and in Gypsy's, she's different from the Menendez brothers because you're believing their word. In Gypsy's cases, there are medical records from years previous where they had charted Munchausen by proxy.
But if we believe, then emotionally we would say, well, I get it. I get why Gypsy Rose killed her mom. Especially for Gypsy Rose, because she was still under the thumb of the mother,
Right. And I was just about to say, the interesting thing about that case is, she was 23 years old and still under the psychological control of her mother. That's how long this abuse can continue. And a lot of people are like, well, that child's 14. Why didn't she just walk away? Well, they don't have that ability. They are psychologically manipulated and controlled.
Yeah. And physically from inside out. Yeah,
absolutely.
Well, so the book is The Mother Next Door, Medicine, Deception, and Munchausen by Proxy by Andrea Dunlap and Mike Weber. If this conversation has piqued your interest, which I'm guessing that it has, you can pick up a copy of that book. I recommend it. As a mild dyslexic person, it takes me a long time to read, but I sat down to skim through it for this interview and got hooked. And I can't wait to finish it. And it has a Seattle connection as well, which is interesting to me. And then I'm going to give it to my wife and say, you got to read this book. It's so compelling, so interesting. And, hearing your story and how I don't know, I wouldn't be surprised if this is made into a movie, honestly. It deserves that, the way that this book lays itself out and the way that she describes things. I think it would be a very, very interesting movie, and I think it would make a big splash.
Well, if you know anyone in the movie industry, give them a call.
You're retired. You got time.
I will. But I will believe that if it ever happens, which I don't think there's a great chance of it. But hey, you never know. A man can dream.
Yeah. Well, and you can find Mike Weber at MikeWeberConsulting.com, right?
That's correct.
And thanks for coming on the podcast, Mike. At the end of every episode, I say that everyone should take care of themselves. But, Mike Weber, why should people take care of themselves out there?
Oh, gosh, just to live a long and healthy life.